Hello and welcome to Mouth Matters, the world's first podcast dedicated to all things oral healthcare. I am your host, Hudson Hector, a dentist and hygienist.
And I'm Jennifer Mitchell, a registered dental hygienist with a passion for making people smile.
Each week, we'll dive into fascinating topics, expert advice, and practical tips to help you achieve and maintain a healthy and beautiful smile.
So sit back, relax, and let's get ready to explore the wonderful world of oral health together.
Welcome, everyone, to the third episode of Mouth Matters. And hi, Jane, how are you doing today? I'm so excited to have you today.
I'm well, doing really well today. How are you?
I'm doing great. I'm so excited. We are here today to talk about periodontal disease.
Yeah, I'm excited to talk about that as well. It's super important.
Definitely. What is periodontal disease and what causes periodontal disease? Periodontal disease is disease of the gum and its structure. But what causes that disease? Periodontal disease is caused by bacteria. Do you agree with me, Jen?
Yes, it is. All of our dental woes are caused by a little teeny tiny microscopic, you can't even see it bacteria,
Yes, that little tiny bug.
little sugar bug in your
Sugar
mouth.
bug. Exactly. But periodontal disease may be more serious than you realize it because it's silent. They call it silent disease because most people realize it when it's a little bit late. I don't want to say too late, but when it's already caused some problem. For example, the first step of periodontal disease, Jen, you don't mind to say it for the audience, it is
The first stage in periodontal disease is gingivitis.
gingivitis, and a lot of people know that it's gingivitis. What is gingivitis? What is the sign symptom? It's when, for example, you are brushing and you see you spit blood.
Hmm.
Wow, it's like pink. I call it pink in the sink.
Uh-huh.
You're brushing and you spit like pink in the sink. And that's when you realize that, oh, something is wrong.
Hmm.
Maybe it's gingivitis. It's part of the periodontal disease.
Yes.
In some astonishing facts, over 80% of US population have some type of gum issue, have some type of periodontal disease.
It's very common. Lots of people have it. They don't realize they have it. Um, you know, statistically speaking, look to your left, look to your right, they have some form of gum disease. Very, very common.
Exactly, because near of people, like near half of people over the age of 30 in America have
Some form of gum disease.
fear of gum disease. And nearly three of every four people over the age of 65 have periodontal disease.
Hmm.
Wow, that's more than I expected.
It's a lot.
Yeah, it's a lot. And again, why that happened? It's because the reason we start that podcast because of knowledge, lack of knowledge, how
Hmm.
we can deal with that. It's okay if people have it, but how you can deal with that, that's the most important thing. And one thing I want people, I'm sure that you tell your patient about that is how periodontal disease can progress.
Yes.
Because bacteria in our mouth are constantly creating plaque,
Hmm.
right? That creamy, cheesy type of something. And yeah, sorry, I'm not disgusting anyone about cheese. I love cheese too.
Yeah. I say
You
it
know,
looks like mashed potatoes on your teeth.
like exactly like mashed potato. We don't want to discuss anyone with that. Mashed potatoes taste
I
really
know. I
good,
hope
but
you're
not this
eating
plaque.
dinner right now.
And if bacterial plaque on the teeth isn't removed, the gum can become infected and inflamed.
Hmm.
What happened first? It's plaque build up and gum tissue become infected. That's when you see the redness, you see the swelling.
Red hot, puffy, swollen, bleeding gums. That's gingivitis.
Done. Simple as that. Great
Hmm.
explanation. Don't have to go deeper than that.
Yep.
And that's when we have pocket deep in between teeth and gum pull away from the teeth while bacteria begin to damage supporting structures such as bones that
Hmm.
support the teeth in periodontal ligament. And what happened next? Infection spread around teeth, bones, gum, like we're saying, connective tissue, the periodontal ligament
Mhm.
can be permanently damaged and
Mhm.
it may need to be removed. That is something that's really serious. Like today, I was doing a SRP for a patient, and because it's for embedded with those calculus and plaque,
Yeah.
what the two was so like shaky or movable,
Oh, the
and that's
teeth?
it. Yeah, that's it come out.
Yeah. People don't
It was hard.
realize
Hmm.
that your gum disease can get so bad. And I just want to reiterate, gingivitis is just the gums being affected. Gingivitis is reversible, it's just the gums, red hot, puffy, swollen gums. Gingivitis, if it is not taken care of and it's not treated, it progresses further to full blown gum disease called periodontitis. That's when the bone becomes affected. And the periodontitis can get so bad that the bone just disappears and the teeth are just flopping in the wind and they literally just fall out.
Yeah, that's definitely what you say is it's so true. It's like very simple explanation. And thank you for saying that because gingivitis is the first step of
First
periodontal
step.
disease. And a lot of time people say, "Oh, I have gingivitis or I have periodontal disease. Oh my God, I'm losing my teeth." No, periodontal disease have gingivitis
Hmm.
and then you have periodontitis.
Correct.
And even go further, if we go when people have implants, when people have implants, that is not natural teeth. It's teeth like I don't want to say fixed, but it's teeth that embedded with titanium in the gum that make it a little bit more permanent than you have a flippers or a dentures,
Yeah.
and it can get infected with those same bacteria.
Yeah. You can get a bad infection.
Exactly. Instead of gingivitis around those implants, they call them mucositis
Hmm.
and then peri-implantitis.
Yes.
That's yeah. There's different names, different that make it technical,
Yeah.
right?
They're all bad though.
Exactly. They are all bad, and we want to just mention quickly about the bacteria that involve in periodontal infections because usually a mix. More often, they describe them as gram negative, right? Strain negative, and
Gram negative.
anaerobic. Yeah. Yes, you can talk, Jane, because I
Gram
know it's your your part.
gram negative bacteria and anaerobic bacteria, those are the bad guys. Those are the really bad guys because they can live without oxygen. And when you don't have oxygen, it just think of it like a bad boogeyman. It's a bad monster. They're some of the baddest bacteria. And in the deepest gum pockets, you have the baddest bacteria, and they're the ones that are really causing destruction to your periodontium.
Exactly. And those two big guy that's quite involved. There's so many that involved in that. We have what they call the Treponema denticola and the Porphyromonas gingivalis.
P. gingivalis.
Yeah, P. gingivalis. When you see the P, you run.
Right.
you know? And there's like a different, we have the Treponema, the Bacteroides, the Porphyromonas, the Prevotella, the Capnocytophaga, the Peptostreptococcus, the
Yes,
Fusobacterium,
they're
the
hard to say.
Actinobacillus. Exactly.
You're
There's
doing a
like
great
I,
job.
f- I feel like I'm speaking Greek now,
I
right?
know. You're speaking dentistry.
Exactly. We're speaking the language of dentistry. In Echinella, those are certain periodontitis that often form together, especially in subgingival plaque. That means subgingival mean under the gum.
Yep.
Supra, that's what you see. It's over the gum. But the one that causes a lot of problem is the sub
Under the gum.
under the gum because they
Mhm.
don't need oxygen and they
Right.
say yes and then they are like you know rapidly cause the problem.
Mhm.
And one of the things generally when you have you see your patient for the first time and you say okay you do a period charting. What do you say to your patient when you go to 1 2 3 millimeter packet and then your 4 millimeter 5 millimeter? Can you tell us a little bit what you said to your patient?
So, in regards to perio charting, I tell my patients normal numbers are between 1 and 3 millimeters.
Hmm.
And fours are we're getting into abnormal numbers. Fours are usually like an indication of swelling. You can have some pseudo pocketing. So it looks like a pocket, but it's really not a pocket. It's just
False
because there's
pocket. Hmm.
swelling. Yeah, it's a false pocket. And then five and greater, there's some bone destruction. You can usually see it in the x-ray where you can see the bone is starting to deteriorate. And once the bone has been affected, uh, you that's the periodontitis once it reaches the bone.
Exactly, definitely. We're going to have a different episode about the periodontitis itself when we
Hmm.
start losing a connective tissue, bone structure, and all of that. It's like Jennifer was saying, like gingivitis is easy to reverse. It is
It's
reversible.
reversible. You can get rid of it with good brushing and flossing every day.
Definitely. And generally, my protocol for patients that have gingivitis, generally I do, for 1 to 2 years. Sometimes the patient don't go to a dentist to have because someone's supposed to have their regular prophylaxis session or cleaning every 6 months if you have a
Mhm.
healthy or beginning of some gingivitis like 4 millimeter pocket, because most likely 4 millimeter pocket is less time for people don't barely floss or they
Right.
don't floss properly. And I wish like you going to go over that whenever we have. Thank God we have a great teacher over here,
Yeah.
very detail oriented.
I'm
Go over
excited to
that.
talk to y'all about flossing. I love flossing, so I'm excited to talk about that later.
Flossing is like the real soldier
Mhm.
against gingivitis and even periodontal disease.
It's
That's
key.
yeah, it's key.
It's
And
key. You have to do it.
unfortunately, many people do not floss.
They don't. They
The
don't find the
brush,
value in it, and they hate it.
unfortunately, because that's very important. Very
Yes.
important for people to do.
Mhm.
And yeah, like the protocol is when the patient just come, we just when you have the puffy, the swelling gum, like
Mhm.
you described for us earlier.
Red
And
hot, puffy, swollen, bleeding gums.
yeah, you got it. I like it the way you say
I say it so much, I can just say it super fast.
it. And we do something that call a gingival scaling with moderate to severe inflammation.
Yep, scaling
Yeah,
in the presence of inflammation, gingival inflammation. That's the
exactly.
gingivitis treatment that you should have to help treat your gingivitis.
This definitely that's important. And of course, some people just come. I just want a regular cleaning.
Right.
No,
Mhm.
unfortunately, it doesn't work like that.
No.
And a lot of patients think they can dictate to the provider or the healthcare professional, I'm here for a cleaning. But we have to tell you what type of cleaning that you are
Right.
here for. That's why we check your gum,
Mhm.
we check your teeth, all of that. We ask you so many questions. What type of toothbrush do you use? How many time you brush? How many time you floss? Do you smoke? Because smoking affect as well your oral health, not only for oral cancer, as well for your
Your tissue.
gum, your tissue. Definitely, because the harder is like the environment and all those those toxins that
Mhm.
also affect your gum. Most likely you will have periodontitis, not
Mhm.
even gingivitis. 98%, because I always live like a 0.2% of a margin of error. I find those patients have periodontitis
Oh, people
and
who smoke.
people who smoke.
Mhm. Yeah.
I barely see someone who smoke that have healthy gum. To say never or have gingivitis.
Yeah.
Unfortunately, that's the truth. That's the truth. You've been in that field for how long? I've been in this field for how long? And that's the truth. That's fact.
Yes. Mhm.
And now it's important, go over all of that, those factors, and that's when we offer a smoking cessation and all of that. That's pretty much part of the protocol as well. As the patient, can you stop smoking for a little while at least? And we go back, we do the scaling, a gingival scaling, and then we use a local antiseptic. Most likely it's a chlorhexidine
Chlorhexidine.
gluconate 0.12%.
Yeah. Also, alcohol-free mouth rinse. Not everyone can have alcohol based products. Chlorhexidine is an alcohol-based product, but alcohol-free mouth rinse is good too. Anything really, just to kill bacteria, make them uncomfy.
Exactly. And one thing I also said in talking about the zero alcohol free, mouthwash, zero free alcohol. If anyone, I have a patient who was smoker or vape,
Hmm.
I do not advise them to get any alcohol mouthwash.
Yes. So alcohol dries you out, which can exacerbate the problem. And smoking also kind of dries you out because when you're smoking, that hot heat goes into your mouth and it's just
Oh
drying you out.
yes. Oh yes. That's the real thing. Yeah.
Yes,
Yeah,
yes.
before maybe in the 1790s, smoking was like really the cool things. I don't think it's as cool. You might have a patient smoker. It's like, that this is like that's not as cool anymore. I'm sorry, Hudson, that's not cool anymore.
Yeah,
I say
it's
I'm
not cool.
glad you realize that. You can change. But definitely that will be a one of our episode about smoking cessation,
Yeah.
that how you can do that and how you can help your friends who want to smoke, because it's not good for the environment. We have second hand smoker, and there's a lot of reason for that. But anyway, let's focus on the of course for the
And the
periodontal disease, because it's
gingivitis.
hard in the gingivitis. And after that, you give the patient some good mouthwash. That is quite important. That reduce the amount of plaque.
Well, first, gingivitis, okay, red hot, puffy, swollen, bleeding gums.
Mhm.
It's it's caused by the bacteria, the plaque, the junk, the gunk on the teeth. It irritates the gums. But first you have to treat it. And a lot of people think, "Oh, I'm just going to get a cleaning and that's going to take care of my gingivitis." The what you need isn't a clean it's not technically a cleaning. It's actually a gingivitis treatment like we were talking about. It's called scaling in the presence of gingival inflammation, and think of it like a cleaning before the cleaning. What I tell my patients is, imagine you are at a hoarder house and you want to vacuum the floor, you want to wipe the counters. Well, you can't. There's a whole bunch of junk in the way. So, the gingivitis treatment, the scaling in the presence of gingival inflammation, it's like you're taking all the junk out of the hoarder house. You're just taking a dump truck, you're just dumping everything. You get all the big junk out, and then you can vacuum, then you can wipe the counters, then you can do the little detail. So the treatment, the gingivitis treatment, we're just going in, we're getting under the gums, getting all the junk and the gunk out. Then the gums will start to heal on their own because it's the junk, it's the gunk, it's the bacteria that's
Exactly,
causing
the
the
calculus, the
yes,
plaque that
yes,
contain those million of those bacteria that we just mentioned
yes.
earlier.
You got to
That
get it out of there.
exactly. And one of the thing when people have gingivitis, even it's like so microscopic fluid secreted in the space between the gum and the teeth, they call sulcus. The
Uh-huh.
curve, it's
The
that's one of the
crevicular
signs.
fluid, yeah.
Yes, that is there as well. People barely realize that. And what you say is completely true, because you have those bacteria. Let's say, okay, I don't care, my gum is bleeding, and some people, my gum is bleeding, I'm just
They
going to
think
get
it's
it.
normal sometimes.
Yeah, yeah,
Bleeding is not normal. Your blood is supposed to stay inside your body. If it's outside, if blood is coming outside of your body, there's a problem. Like if you get a cut, blood comes out. That means that you're injured. Same with your teeth and your gums. If you're brushing and flossing and there's blood coming out, there's a problem. We need to fix
exactly. Blood,
it.
pink in the sink. We don't need any pink in
Nope,
the sink.
not at all.
Right. That just keep it clean. Keep it
Keep it
clean is very
clean.
important. And one of the fact and to do that, like the regimen, it's flossing, brushing, and importantly as well is to use a mouthwash. It's
Mouthwash.
not like you use any mouthwash. Okay, I'm going to Costco or BJ's, I'm going to Walmart or
I'm
Walgreens,
gonna use
I'm going to stop it,
peroxide.
or peroxide. No, you have now, when you have that, you have to ask your dental hygienist or your dentist, your provider, it's like, what is the best mouthwash to help me? What I was saying earlier, some patient, oh, my gum is ailing, and then they'll walk in the aisle of, of Target, and they see that toothpaste, a Periodontax,
Yeah,
because
gum
it's got gum,
detoxify or something.
gum bleeding and something like, oh, gum detoxifier. Oh, it's good you get a gum detoxifier, but you cannot detoxify something that already built up. You cannot
Right,
detoxify a calculus, a
right.
equation like that.
You gotta get the
You
junk out first.
Exactly. You need a mechanical removal of those
Mhm.
junk. That's
With
the scaling.
the
And then
scaling.
after that, when like Jennifer said, you remove those junk, and then you open the way. Now you can use your cloth and clean those counter with a adult, with a prophylaxis,
Yes,
right? In the 3 to 4 weeks,
yes.
and no, that's quite important. That's quite, it's something that is reversible, that we've been saying. There's hope, we can change that. It doesn't have to stay
We
like
can
that.
save you. We can save you and your teeth.
Yes, definitely. We don't have to reach that periodontitis level where you start losing a bone structure, those ligaments, those connective tissue, and even have their own extract by itself. But in the other episode, when we talk about periodontitis, I will share my what I've seen before with the previous patient that I have, 45 years old, that we have to have a full mouth extraction and does not have one cavity, not even one carry,
Hmm.
but have to do a full mouth extraction
Oh
to
no,
have
yeah,
all
that's
implant.
unfortunate.
And quite say someone that is educated, but we'll talk a little bit more about that in the next episode.
Yep.
I'm
Okay.
excited, and I think we cover a lot regarding the first part of periodontal disease and especially gingivitis. There is hope. We just to
Hope for
create
you.
awareness is information. We can go see your provider, get your cleaning done, get everything under control,
Get your
get the
gingivitis treatment if you have gingivitis. Go
exactly
often to your dental care treatment, your dental care appointments, and you have to maintain at home with good brushing and flossing. You
yeah,
have to.
good oral hygiene is very important to maintain that.
It's
It's like
your
you buy a car,
responsibility.
nice car, and then you don't maintain it,
You
just
got
like
to
a
change the
house.
oil. You got to
Just
put air in the tires. You have to, or it's going to break down.
definitely that the same thing as your mouth. And remember, your mouth
Your
matters.
mouth matters.
That's why you need to take care of it and take it of
Exactly.
it properly, not the way you think. We are here. Just send us your question, on social media, on Instagram, on LinkedIn, on Facebook, on TikTok, on Podbean, on Apple,
YouTube,
wherever, YouTube, and our
email,
email.
email us.
Email us, and we will be happy to respond, to reply to you, and we can even have a episode to respond your questions, a
Yeah.
Q&A session. That will be fantastic to
Hmm.
respond to our audience.
Okay.
Okay, Jennifer, what do you have for us today? Is it the brushing? What is it? I'm excited.
So today, because we're talking about gum disease, and we're going to talk about flossing today. So flossing, like we mentioned, is key to fighting all types of gum disease, starting at gingivitis. Okay, and even if you have full blown gum disease, periodontitis, you still have to floss to keep it at bay. Periodontitis can get worse. Gingivitis can get worse. It can progress. So to keep it at bay, you have to floss. So we're going to floss today. So take a moment, everybody, go get your floss. You can use string floss. You can use floss picks. I see Hudson has string floss.
Of
I
my
have a
string
floss
is my
pick.
it's my best, and the reason you take it arm length, right? And then it's helped me to change any part that is dirty.
Yep,
I can, like in my right finger, and I roll it the dirty and the new,
yep.
dirty and new, dirty and new, and then
Yeah,
we get it done. Get
yeah.
those bacteria, those
Get them out of there.
gingivales, just strip on him and strip on him out and get those bad guy.
Yep.
Perfect.
Hudson has his string floss. I have my floss picks here. Feel free to use as much floss as you need. If you need to use 6 feet of string floss, do it. If you need to use 10 floss picks, do it. So here we go. We're going to floss. You also need to start in the very back of your last tooth. I know it's hard to reach, but you got to get back there. So let's start flossing. Get in there. Hudson.
I'm
We're
starting the
flossing.
upper.
So you gotta, when you floss, you gotta wrap your floss around the shape of the tooth so the floss slides all the way under the gum. The string floss, it's easier to do that technique, but floss picks, you can kind of sort of do it as well. It's better than nothing.
Exactly, exactly.
Get it on there. Mm.
And remember, the two are not straight like a box. They have a
Mm-hmm.
shape. They are like at certain angle.
Yeah. And make sure you're sliding your floss all the way under the gums. That's where the plaque, the bacteria, the junk, the gunk is. You got to get under the gums. If you're just popping your floss in between the tooth, you're not doing it right. You got to get under the gums.
Hmm.
So get in there. Mm. And also, a lot of people don't like flossing. I want you to change your mindset about flossing. Think to yourself, I'm massaging my gums. I'm giving a little massage to my gums. It feels good. Be really careful. You can cut the gums with your floss. It's called a floss cut. You want to be really careful with your gums. So be gentle. Take your time. Get in there.
Don't fight with it.
Don't fight with it. Be
Just
gentle.
gentle. I said to my
Hmm.
patient, just dance with the
Just
floss.
dance, yeah, just move and groove with it. You wanna get both sides of each tooth, so just make sure you're
Mhm.
getting everything. Mm. I love that the floss I have minty floss, and I love that it makes my gums feel minty fresh.
Yeah, I like the peppermint.
Mhm. Yeah, and there's also different types of floss. I like, Oral-B Glide, it's kind of
Yes,
satiny and
that's my
flat.
favorite. That's what I'm using now.
That's my favorite. This is an Oral-B floss pick. I hate it. You might have to try different flosses to find one that you like. What works for me might not work for you. Some people like a more natural floss. There's cocoa floss, which is made out of coconut fibers. It tastes like coconut. It's very tropically. Um, but it's kind of like the fibers are kind of thick. So I have really tight teeth because I have braces and they're tight. So the floss didn't do well going in my teeth, but for someone else, it might do really well.
I might need to look for a pineapple or mango because I
Mm,
love this fruit.
yeah. Cocoa floss has different flavors too, so,
Mm,
get in there. I'm switching to my next one because I already used that one. Going on, doing a top now. Mm, get in there. If you have to change floss, go ahead and change it. Look, I pulled something out. It's my dinner.
nice.
I know. Get it
Yeah.
out of there.
You see, all the dirt where I put it in the right hand, and the new fresh one I keep moving after. I worded it after one or two is space or
Uh-huh.
interdental space to make sure that I don't put the same bacteria because there is bacteria somewhere in the
Mhm.
other part.
Yeah. You don't wanna just transfer the bacteria around. You wanna get a fresh piece of floss or a fresh, floss pick.
Nice.
Mm.
And for me, that's it. I have some
Uh,
long fingers. I get it in.
I'm almost done. I'm almost done. I'm taking my time. Also, another fun fact, make sure to floss before you brush. Flossing first pulls more debris out. Brushing first tends to push it in deeper and makes it harder to floss out later.
Great point. Great point.
Oh, also, you can dip your floss in mouthwash and floss it in between the teeth and under the gums. That'll also really help the gums. Also, you can dip your floss in toothpaste and floss it in between your teeth. That'll also help the in between parts of your teeth.
Great, great. And one other thing, there's a water flosser as well. I want to tell our patient, our audience, that it's not an alternative to that floss with the
No,
string. Or not. It's complementary.
it's a supplemental tool. You got to use it in conjunction.
Exactly. And also, what I said to my patient, when you use a water flosser or Most people call it a water pig because you are the
Mhm.
first company who started
Yeah,
that concept. Is to go 50-50, 50% mouthwash, 50% water.
water. Yep.
It can be
You-
lukewarm water, and
Yep.
it do a better job at that. And remember always to scrub your tongue,
Yeah.
clean your tongue, because
Clean
those
that
bacteria
tongue.
love the moist part. They love it.
They love it. You got to get it out
And
of there. Make
yes,
the bacteria uncomfy. We don't want them in there. You make them uncomfy so they go away.
exactly, exactly. Jen, I think that pretty much conclude our session with the flossing.
Yes.
And for our dental facts, before we end the episode today, the periodontal part one episode, the
Yes.
gingivitis episode, ding 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 ding, dental facts.
What's the dental fact? Drrrr.
Our dental facts today, we're talking about periodontal disease. We give you
Mhm.
the statistic about the US and about the world. About 19% of the world population in 2023, that is about over 1 billion people, have gum disease, and those people are over the age of 30 and up.
1 billion
And
people have
over
gum disease.
1 billion people in the world have gum disease
That's a lot.
over the age of 30 to 65.
Wow.
And I'm sure that you see that 16 years old, 15 years old have periodontal disease. They
Hmm.
have what called the juvenile periodontitis and all of that.
Yep.
And we're going to talk about it at the next episode. Thank you so much for being here at our third episode of Mouth Matters. Remember always to take care of your mouth, floss, brush, use a mouthwash, and especially remember to scrub your tongue. Don't let those guys in. Remember, pink in the sink, it's not good. We
It's
don't want
not.
to see any blood.
No
We
pink
should
in the sink.
no pink in the sink. Thank you so much. Thank you, Jen. And hopefully you have a good day. And I cannot wait for the next episode.
Thanks again, Hudson. And don't forget, your mouth
Mouth Matters.
matters.
That's it all for today's episode of Mouth Matters. Thank you so much for joining us on our journey to better oral health.
If you enjoyed our conversation, don't forget to subscribe so you never miss an episode. If you have any questions, comments, or suggestions, feel free to reach out to us on social media or email us at mouthmatterspodcast@gmail.com.
Keep in touch and send us your feedback.
Until next time, keep smiling and remember your mouth matters.